So make note of that. If you didn't hear that, it is coming up now. You are being recorded. But thanks for joining us today. And the recording for this session will be available by October 22nd. We do want to hear from you today. So make sure you're using the chat. Let us know what you think, answer questions, use that chat feature because we do want to hear from you today. When you're not speaking or been asked to speak, definitely keep yourself on mute unless the speaker has asked you to unmute yourself. Watch that chat box because there will be information about continuing education credits coming up in that chat box regularly. So make sure you keep an eye on that chat and listen for great information. Right now, I will be turning it over to Miss Deanne. She is going to introduce our speaker.
Right. Well, welcome everybody. Thank you, Crystal. There's still some in the waiting room coming in. I'm going to let one more person in. All right. Well, I'm glad you're here and I'm really excited, and I hope you're just as excited as I am to hear from Dr. Clarke, who is going to be talking to us today about supporting children's behavioral health during a pandemic and beyond. Dr. Brandy Clarke is an associate professor and licensed psychologist in the Department of Psychology at the Monroe-Meyer Institute for Genetics and Rehabilitation, as well as the director of the Office of Equity at the University of Nebraska. Yay, I'm a Nebraska fan from Nebraska, Nebraska Medical Center. Dr. Clarke is the project director for Mid-America Mental Health Technology Transfer Center, and which is a SAMHSA-funded regional training center focused on implementation of evidence-based mental health interventions in Iowa, Kansas, Missouri, and Nebraska. She also leads several large-scale training and research grants focused on integrated behavioral health care and school mental health. Dr. Clarke serves as a mentor trainer for junior faculty, graduate students, interns, and postdoctoral fellows who are entering the behavioral health workforce and related fields. She has co-authored several book chapters and peer-reviewed articles on the topics related to evidence-based interventions supporting children's behavioral health, and has served on the editorial board and as a guest reviewer for several scientific journals. So we are very privileged to have her here and to learn from her. Thank her for being here, and I'm going to turn it over to Dr. Clarke.
Thank you, Deanne, and thank you for the invitation to be here with you today. I'm excited to be a part of your summit and to get to learn from and with you. I recognize a few of the names here in our audience today, but many of you will be new to me. You got to hear a little bit about who I am and what I do. I'd love to get to see who all is in the audience today, if you don't mind entering in the chat box your name and your role, what it is that you do. Give me a sense for who all is with us today. I do hope for us to have some interaction and engagement around this content, and definitely some time for questions. So looking forward to getting to engage more with you. It's always a challenge when trying to do things in a virtual audience. I do miss some of that interaction, so we'll try to find some. So today I'm going to be talking about how do we support children's behavioral health during a pandemic and beyond. It's always interesting to put together content as we're talking about the pandemic, because to be perfectly honest, I don't know what stage we're in anymore. And I'm not really sure how to refer to time, but we'll do our best to try to make sense out of it in terms of what we can learn from where we're at. So as mentioned, you got to know a little bit about me and my background. One of the things I like to say in terms of what it is that I do in my role, I am our project director for our MHTTC, which I'll describe here in a moment, but I like to tell folks that my background is in what I'd call pediatric school psychology. What I mean by that is I'm trained as a licensed psychologist and a school psychologist to work in school settings, but I also work in integrated primary care. So I work a little bit in medicine, I work a little bit in the community, and I work a little bit in schools, kind of have a role in a lot of things. So that contributes a lot to the knowledge that I bring when I speak about these topics. Again, thank you for sharing. I'm kind of watching who's with us in the audience here today. I appreciate you sharing that with me. So just a little bit of a disclaimer, I need to start with this to let you know that this presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA, that is our funder. All of the content in here is free for your use. It will be available to you after today's session, so that we just ask that you don't reproduce it for a fee, that it's free to distribute. Also important to make note that the opinions expressed herein are mine as a speaker and do not reflect any official position of the Department of Health and Human Services or SAMHSA. So now that we've recorded that, we can move on. We also like to set the stage when we're having conversations about topics related to behavioral health and stating that as a network through the MHTTC, we use affirming, respectful, recovery-oriented language in all of our activities. So we use language that's strength-based and hopeful, person first and free of labels, non-judgmental and avoiding assumptions. So I just want to set that stage as we begin to have conversations today, that's the lens that we're going to be using. Also important to note, as you saw, SAMHSA is our funder, and through that, and because of that, we will be asking that you complete an evaluation today at the end of this session. They do want to see that we get 80% participation from those that attend our events. One, so that we can maintain our funding in demonstrating, yes, we do have people in the audience when we present, and also that we're getting your feedback. And we really, truly do value your feedback and participation and use it to help guide the content that we deliver. So you will be getting a link to complete a survey here at the end of the session. All right, we covered a little bit of our business stuff. Now let me explain who we are and what it is that we do at the Mental Health Technology Transfer Center. We are part of a broad network, and I will show you a map here in just a moment that tells you a little bit about who we are. But our job within our training and TA network is to help accelerate the adoption and implementation of mental health evidence-based practices. So really what that means is, how do we take what we know works and get it into practice, put it into the field. To do that, our job is to help to develop the resources and disseminate those to all of those in the workforce so that you have what you need to be able to do the work that you need to do. Because we are grant funded, we're able to offer these trainings and our technical assistance through free or low cost. Most of our work is free or low cost. And we really are here to help heighten your awareness and your skills for how you do the work that we know is effective. I'm going to go to our map here to show you what our network looks like. So you'll see here on this map, we are located right smack dab in the middle, right there in the yellow. So that is where Region 7 is. That we cover Kansas, Nebraska, Iowa, and Missouri. And we are what is called Region 7. So if you take a look at this map, you'll notice that there are 10 different regions that cover our states and territories. Maybe I think most of you are coming from Kansas area. But you'll notice where our other MHTTCs are located. We also have 2 national MHTTCs. We have the National Hispanic and Latino MHTTC, which is located out of Puerto Rico, and our National American Indian and Alaska Native MHTTC located out of the University of Iowa. And we have a network coordinating office located out of Stanford University. The reason why this map is helpful or important to show is that it's helpful to let you know that we are part of this national network of trainers. And so at our disposal, we have this connection to a lot of different groups and folks with a lot of areas of expertise nationwide. So if there's something that people need help with within our region and we don't have access to it or knowledge about it, we have a large network that we can turn to gather information. And so we're pretty lucky to get to be a part of this broad group. Within the field of mental health, you'll notice we talk about doing training and technical assistance on evidence-based interventions. That's a pretty tall task. There's a lot of good information out there, a lot of stuff that works. And so within each of our regions, each of our centers, we have what we call our specialized training topics, or our areas of expertise that we focus on. For our region, our primary area of expertise includes those top two. One would be integrated behavioral health and primary care. Many of our faculty have done actually our clinical trainers as well, meaning we actually provide service in integrated care settings, as well as provide training on it. We also focus on the areas of school mental health, which is more of the content I will be talking about today. Two other secondary areas that we cover would be community-based interventions related to serious mental illness and behavioral health workforce development. If you noticed our 4-state region, I'll be talking about that here in a moment, is fairly rural. And we do have mental health professional shortage areas in most of our counties. And so it's another reason why we focus on that content. So a little bit about who we are and what we do at the MHTTC. Today, I'm going to talk to you about, well, what do we know about student behavioral health and how we can address that, especially within the school context. So I like to start off by kind of setting the stage for what it is that we're talking about when we think about what is student behavioral health. And I love this picture here. I like to imagine that this group here might be your group of incoming kindergartners, super excited to start the year, maybe their first day. You can see their backpacks are even bigger than they are. Lots of big smiles. So this is, we'll say, post-pandemic. No one's wearing masks here in this photo. They're very excited about the school year. So let's think about this group of incoming kindergartners here and what it is when we're talking about what we think one skill would be that you would wish for all of those students to have by the time they graduate in order to be successful. So take a moment. I want you to go ahead and use your chat feature here if you can and think about what one skill would you wish for all of those students to have by the time they graduate. Give you a moment to think through that or watch the chat here. Learning to be part of a team, strong self-identity, writing skills, able to form relationships, self-sufficiency, resiliency, motivation to be engaged in life, nice, independence, resiliency again, good communication skills, those are important. Another moment here. Coping skills. What's interesting when we do this activity is seeing the list of skills. No one really ever puts in here that they need good pre-algebra skills. They need to understand biology. Not that any of those things aren't important. This was a first to see good writing skills, which I will also put in that category of good communication skills. I think writing most definitely is important. But what we're talking about here are some of those skills related to the social emotional learning, or some might even refer to as kind of the soft skills that students need to possess to be successful in getting jobs, making and keeping relationships, on navigating challenges. That these things we recognize are the skills that they are going to need to be able to get jobs and keep jobs. And to have fulfillment as adults. Some of you may or may not have seen this, the social emotional learning skills identified by Castle. But one of the things that I want to stress here is when we're talking about behavioral health promotion, when we're talking about the spectrum of how we help promote well-being and also how we help to address when things aren't going well. How do we address mental illness, behavioral health challenges as well? That it's the scope of all of those things, from how do we promote these positive coping skills and social emotional learning, all the way up to how we address when things are not going well. I also want to highlight the approach that we take to make sure that when we're talking about students' behavioral health, we know what it is that we're referencing here. So I would call this what I would refer as to my theory of change. When I talk about student behavioral health, what do I mean? I tend to think about student behavioral health as fitting within a whole child approach. And what I mean by that is that when we talk about supporting behavioral health, we're talking about optimal functioning across all domains of life, that we're not segmenting out behavioral health from academic functioning and all other areas, that we think about the child as a whole and that all of these parts fit together. I also talk about behavioral health as being influenced both by one, what kids bring to the table, their genetics, their temperament, their makeup, and then the environment within which they live. It's influenced by their nature and their nurture together. But that the approach that I take then to addressing it is how I teach then coping and self-regulation skills, how we work within establishing healthy environments so that we can both promote well-being and address challenges as they arise. So this kind of helps set the stage for when I talk about it, what am I referring to? You will see in some of these slides that I will use this term behavioral health. Sometimes on some of our content, we'll also refer to it as mental health. I personally am not making a distinction between the two as being separate. I see them both as being highly integrated within each other, but some of the content, the wording on some of the content will refer to them back and forth. When we're talking about mental well-being or behavioral health, it is also important for us to recognize that these things do not exist within a vacuum, and we don't address them within a vacuum, that our socio-political context has a great influence on our development of our well-being, and that is it also plays a critical role in then how we need to address and support it. So to set the stage for what are we talking about here, it helps us to think about prevalence for some of these conditions for mental behavioral challenges. What does it mean when things aren't going the way we want them to? And what numbers are we talking about here? So prevalence rates in terms of mental illness or behavioral health disorders. And I'll be honest, it's a little bit tricky for us to kind of talk about this pre-pandemic and post, because we aren't really post yet. And we're kind of in this phase of still gathering information in terms of understanding how the pandemic really is influencing what we're seeing. So keep in mind that some of our information, our data is still coming in. We're still learning as we go. So one source of information, our National Institute for Healthcare Management. I like this because they use nice graphical and infographic information that I could borrow very readily. Helps us to put some of these things into context. So talking about pre-pandemic, what are some of the things that we knew? That 75% of all mental illnesses developed by age 24. Meaning what's important about that for us to recognize is that many of these conditions develop pretty early on, and the majority of them are developed in some period of either childhood, adolescence, or early adulthood. And so early intervention recognition is pretty important. What we also know, again, pre-pandemic, is up to 1 in 5 children would have a diagnosed condition. And what that means by diagnosed is that they would meet criteria that their symptoms are impacting their functioning enough. They would meet criteria for a diagnosis. If we put that into context of a typical classroom, and we'll just say if that classroom has anywhere between 25 to 30 students in it, 1 in 5 means 5 to 6 kids per classroom would meet criteria for a diagnosable condition. And that helps us to put some reference then to how many kids are we talking about in terms of that may need some level of support. Again, keeping in mind those were our numbers pre-pandemic. When folks refer to mental illness, and they're often referring to anxiety and depression, but those are two conditions we're keeping a close eye on as it relates to the pandemic, because we're seeing a lot of things that might stressors that might impact those conditions. And we've also been keeping an eye on them because we're seeing that rates of major depression have been rising in young children in the last few years. This is concerning for us because we're not exactly sure why. We have some hypotheses, some reasons why we think that's happening, but we are definitely seeing across the board an increase nationwide and within our own region. We're seeing that as well. So important for us to attend to, especially as we think about resources and what access to care. One point that's important to note is that adolescent girls are 2 times as likely to have an episode of major depression in comparison to male peers. That does not necessarily mean that our males are not experiencing rates of depression, and sometimes might be a little more harder for us to identify. The other thing pre-pandemic that we've been keeping an eye on that's been concerning, our rates of suicide have been increasing. And it's another one that gives us reason to be cautious, is that we know, again, some of the things that are related to those stressors of the pandemic may impact these numbers that we're seeing as well. And so it is important to note, though, we do not have accurate numbers currently, that these are usually collected on an annual basis. And so we're watching this, but don't currently know the full impact yet. What we're also seeing is, it's not new information to us, but something that I think has been highlighted more throughout the pandemic than before, is that access and barriers to healthcare are an increasing issue. And this relates to issues of inequities for us, and that we're seeing, again, more of our students of color, our Black, Latino, and Indigenous children are in areas where they have less access to care, or care that would be culturally appropriate for them. And so that creates inequities then in terms of them getting the kind of support that they might need. Also seeing that our students, our LGBTQ youth, are reporting that they are not always able to access the type of care that would be appropriate for them.
And that means
Higher
that
rates. So this is important for us to be attending to in terms of how we look at our data and our own communities, and looking at how we might break apart data so that we can pay attention to our own equity and access, and are we reaching our subgroups within our own communities as well. So to bring this home just a little bit, I wanted to share some data that was gathered through the Mental Health America survey. This is used nationally to help states rank where they fit along some key indicators of data that's collected around major depressive episodes, also data related to access to care. So just a couple of things here to highlight. You can see states rankings. So I pulled data for Kansas youth here, so we could take a look at where does Kansas compare in terms of national rank. There's a couple of areas where you would, the data you want to be higher in rank, and those would be when youth are receiving consistent treatment here, and also those who are identified for IEP services in schools. Higher ranks are actually better indicators. But this helps to just put a little bit of the information into some context for where does Kansas compare nationally when you look at some of this information and data. But keep in mind, this data again was gathered pre-pandemic. So it does not currently reflect data from the year 2021. It's the data that's being reported at this time. It was gathered in, I believe, 2018. So what do we know about the impacts of the pandemic and what it's doing related to children's mental health? Well, all of the things that we know to be stressors that would impact one's well-being, behavioral health, and access to care we're stressing our system. There's stress on our children, on our adults, and even our providers. So it's kind of this perfect storm of all levels of stressors that we might see. So related to the uncertainty of, again, like I mentioned right from the beginning, we don't know currently what stage we're in. We don't know what to expect and when to expect it. So that level of uncertainty definitely creates some stressors. Social isolation, especially for those who have underlying medical conditions or health conditions that have made it difficult for them to come back to school, engage in their communities, have had prolonged social isolation has made it even more difficult for them. School closures, and we're kind of in this stage of like flexibility with that. But I might say more just disruption. Does a classroom have to go on quarantine? Are we going to be back in person? These disruptions can be quite stressful. With family challenges, with those related to economic instability, health and wellness, and unfortunately for those who lost family members, we're seeing high rates of grief and loss related to that. Then also difficulties related to accessing care. In some of our communities, lack of internet or broadband capability made it difficult to have telehealth access at all points in time. We're also seeing that we have fewer mental health screenings being done or collected because of school closures or lack of accessibility to students, but also because students aren't receiving the pediatric care they used to receive on a regular basis, and have been delaying some of that care due to the pandemic. So again, those are some of the things that are not only just stressing our students, but stressing our care system in general. We have seen, though, emergency visits are increasing, and unfortunately that becomes then a point of crisis care where more students are accessing behavioral health services through emergency visits, which would be less than ideal in terms of the type of care we'd like to provide. I am not going to go too much in depth into this, but these are the kinds of things that we're seeing, not just related to stress, depression, or suicide. We're seeing higher rates of anxiety. We're seeing more reports of behavioral concerns, even in our younger kids. Tantrum behaviors, difficulty with emotional regulation, more suicidal ideation, but then also difficulties with attending and engaging in learning, and identified learning difficulties for many students who had to try to do more learning online, didn't have access to the learning supports that they would normally have. We're also seeing identified more learning difficulties. And again, this is another area where we're seeing that there are some inequities in terms of this data for students who weren't able to access learning online or learning supports, more learning difficulties over time. And those are we're just scratching the surface of what that means in terms of what students are going to need to be able to catch up. But along with our students, we are also seeing that the significant adults in their lives are also having some pretty significant stress and stressors in their environment as well. This data, even as I pulled it, I realized even this feels out of date. This was gathered the summer of May 2020 on the APA stress survey that's conducted every year, identifying that the group with the highest rates of stress in our adult population are parents. And that the experiences related to COVID had exacerbated their stress levels, and that distance learning, managing care for their children, missing major milestones, and healthcare services were significant events that were impacting parenting stress overall, and why this group out of all adults was having the highest level of stress. I will say, I know I can speak anecdotally for myself and for others, that stress has not gone down since last summer. In fact, at the start of this school year, it was exacerbated significantly with changes in protocols and routines, and some schools masking, some schools not, some schools needing to go on quarantine, some schools not, that just managing care, period, whether kids were in school or not, has become a significant challenge, especially if you're working and trying to manage that at the same time. Another group, as we have mentioned several times here, people of color also identified that they were significantly more stressed related to COVID. And we've seen that related to all the inequities that we're seeing related to access to healthcare and access to behavioral health services. Another group of adults, though, that we know have a large impact in education systems and how students are doing would be our educators, our teachers, our administrators. And I probably don't need to explain this to all of you. You probably get this very well. Our educators are about as burned out as they've ever been. And educator burnout has always been an issue that we've needed to address. But what we're seeing now is that 3 in 10 members who were recently surveyed through the National Education Association are saying that the pandemic has made them more likely to leave the profession than earlier planned. So as we're also seeing within our medical system, we're losing our staff, we're losing our providers. We're also going to be seeing, we're losing our educators. And I don't know about you in Kansas, but I know in Nebraska, that's a significant issue for us. We have a shortage of professionals in our school system, especially our para-educators at this point. All of our school districts are desperately seeking assistance because they're losing out on their staff. And burnout is one big reason why. What we know then too is when our teachers are stressed, that impacts then our students in the classrooms and their engagement. Teachers are not at their best when they are experiencing high levels of stress. And it relates then to the learning environment that's established within a classroom. It actually, even we see that data that when teachers report being overwhelmed, we see those students within those classrooms have higher cortisol levels. So it directly relates to the stress that students experience as well. As I mentioned, I feel like so far everything I presented is a doom and gloom slide. I promise I'm getting to something that will feel a little bit more uplifting here in a moment, what we can do about it. But as previously mentioned, it is important for us to recognize too that we also live in a community, in a region that would be considered high health professional shortage area in terms of mental health providers. So within our communities, we don't have enough providers to meet our needs at this point in time. So this is data as of taken September 9th of this year. You'll notice white areas on the map being those where the ratio meets the need, or the light blue, I mean, that we have very little light blue within our 4-state region here in the center of the map. More of our rural communities in our 4-state region, Missouri tends to have more of those. Oh, actually, sorry about that. I didn't mean light blue, I meant gray on this map. There is a little bit of gray there on the eastern, mid-eastern side of the Kansas border, if you recognize that area. So what do we do with all this information? We know our needs are going up. We know our community providers, we don't have enough of those. We know our teachers are stressed out. So when we think about the things that we can do to address that, building school mental health programming in a comprehensive way is one way where we can help to address the need. And it's actually one of our most effective tools that we can do. If we can create comprehensive programming, what we see is that of the youth who receive mental health services, the majority of those actually access those services within their schools. So 3 out of 4 students will get their support from their school system. What we also see is that when students do get support within their school, they're 6 times more likely to complete treatment because it's accessible to them, it's available to them. They're not having to leave the building to go get support elsewhere. Parents aren't necessarily leaving work to go do that every session or every visit, so that it becomes a more efficient way or more effective way to deliver treatment. In terms of impact, we also see that students who are participating in social emotional learning programming within their school buildings also experience improved academic performance, the things that everybody, in terms of the bottom line, we know that's what schools are evaluated by. So putting and investing that time in that programming actually helps them meet their bottom line of increasing academic performance. The things that we talked about very early on about the skills we wanted to influence, we see it matters in terms of how well kids do. We also see too then that a positive school climate improves school safety and decreases bullying. The other things that we know that we have a lot of concern about is safety within our buildings, and comprehensive programming helps to address that. What do I mean when I talk about comprehensive school mental health systems? And it's important that I want to highlight a few things that these systems are built upon. One, it is a full array of supports and services that promote well-being, as well as reduce the severity of mental illness, what we talked about in the beginning. Those things that promote well-being, reduce our challenges. It is also built on a strong foundation of district and school professionals, those within the school system already, hired by the school system, working in the school system, along with strategic community partnerships. So both working hand in hand, not one or the other. That foundation is really key to help making something comprehensive work well. We also are talking about assessing and addressing social and environmental factors that impact health and well-being. As you recall, I mentioned earlier that when we're talking about environment, we can't just be talking about students. We can't just be talking about educators. We need to be talking about the culture and the climate, the setup within our system, and how that impacts well-being or doesn't. So that those things are all part of this comprehensive system of support. You may or may not be familiar or have heard about multi-tiered systems within school systems, but these levels of support recognize that our resources are best allocated when we can identify where we need to place them. And if we can provide a certain level, a foundational level of learning for all students, most students will do well. And so we can invest some resources in universal learning about social emotional skill development, problem solving. If we put most efforts there, that 80% of our students are likely to respond well to it and will be successful. That second tier of support would be then maybe another 15% of our students who are going to need a little bit extra time, a little bit extra adult support, a little bit extra practice to gain those skills. And we invest time then in working with those students, maybe in some group supports or providing extra practice for them. But then we'll have our third tier where about maybe 5% or 1 to 2 students in a classroom are going to need some more individual or intensive support that requires maybe some one-on-one time, some more intensive intervention, some maybe referrals or work with some community providers. So what this level of support helps us to identify is where do we place our resources then when we're thinking about how we build a comprehensive system, and how do we navigate it so that we're meeting those needs. Keep in mind that this was all pre-pandemic. Those numbers and the way that we used to think about it were our pre-pandemic numbers. We now all collectively have gone through a lot of community stress that is going to impact then the way that we address these needs collectively. We might need to invest a little bit more in our tier 1 than we used to, because collectively we've all experienced a lot more stress than we have in the past. We also recognize that we need to be doing more to address inequity. That has showed up in just about every slide, everything we've talked about today, that we're recognizing that we have had inequities in terms of access and resources and outcomes for far too long. And it's important that equity is built into everything that we build, every place that we place our resources, and making sure that those resources we identify are culturally appropriate for our communities. So in terms of addressing student mental health amid COVID, what are some things that we need to consider? And I even laugh as I put this. I intentionally left this picture on here. I pulled this for a presentation a while back when we talked about staying connected, keep learning online, and we miss you. That was a stage where we were all in a point of learning online, and where our schools were shut down. We're kind of now in the space of, well, some of us are and some of us aren't, and some of us are going back and some of us are in quarantine. We're kind of, there's a lot of variability in the way things are working and what we're experiencing. And so as we look and plan for moving forward, variability, it's one of my bullet points on here, is something we're going to need to expect. We're going to need to be able to plan for how to shift and how to pivot when needed. And we've learned a lot in the past 18 months, 20 months that helps us to be able to do that. So a couple of things related to this, and then I'm going to talk about resources here that will help you to be able to do some of these things. One is assessing infrastructure for universal screening. So as we mentioned, we've missed some time and access to students for a while. We've been missing those students in terms of being able to do regular screenings with them. But we also know now that we have more students who've experienced stressors than we have in the past, and that identifying those needs that they have is going to be really important. So assessing where we are in terms of what needs we're ready to meet, and then what do we need to do to make sure we can screen for those and prepare for those that we think we might need to identify. We also, again, as I mentioned before, need to look about how we're providing our multi-tiered supports, and think about how we're allocating our resources, being prepared that we may need to offer more tier 1 support than we have in the past, simply because as a broader community, more of us are experiencing these higher levels of stress. And so that resource allocation may need to look a little bit different. And again, we need to do so with a lens toward equity. How have we been responding to the needs of all within our community, and have we identified that well? Having a triage process. This is one thing that I think some of us need to just come back and revisit our plan for how do we assess crisis, how do we assess needs, and how do we help move along those tiers seamlessly when we have students who are going to need support from us. And unfortunately, because of the significant number of students who've had grief and loss and unplanned grief and loss, we may need to use this process pretty regularly to assess needs. We're going to have students coming to us that we weren't expecting to have, because we don't know at any one point in time what they're going to be experiencing. Establishing a sustainable method for telehealth. If you don't have one already, we've seen a higher uptake in people using this as a resource, but as our regulations change, as rules change, we need to look at then how do we sustain what we've built, and how do we continue to provide access so when we do have quarantine or things come up again, that we might be able to continue to sustain it. And the last thing I'll just highlight here is, again, developing a multifaceted approach, something that allows us to be able to address our variability when needed, how we can work in person, how we can work online, how we can meet needs where we need to meet them. I will reference some tools here in just a moment, but these, I think, strategies are important for us to think about as we move forward in terms of how are we going to be able to sustain the work that we've been doing in addressing our students' behavioral health. At the core of all of the work that we do, I want to highlight that one of the most important things is the relationships that we are building. If we can maintain those, if we can keep relationships at the core for our students, for our educators, that will go a really long way. So at the end of the day, when all else feels like it's getting really hard to navigate, remember to put that at the core of how can we maintain and sustain strong relationships. If we can do that, then we've got a compass to navigate, help us navigate what we set up and how we provide our service, because that has a lot to do with access and helping to create experiences where children feel hopeful, they feel supported, as if we have built some strong relationships. So resources to help you to be able to do this work. And I will cover these here quickly in terms of what we offer through the Mid-America MHTTC and our network, and then we'll get to some questions here in a moment. First things first, I just want to let you know or help you to navigate. If you haven't yet, look us up online. You can just type in MHTTC or Mid-America MHTTC, and you will find the network. We have a repository of hundreds, if not thousands, of resources available to you through our center, but also the other 9 that I mentioned, in terms of how to address student mental health and well-being. All 10 of our centers, this is a focus for all of us. So there's a tremendous wealth of information provided in our websites, including webinars, research briefs, handouts, toolkits, a lot of great information there, especially for those of you who are looking for anything related to telehealth. There's actually a whole web page dedicated to that if you're looking for information on how to maintain that. A couple of key resources I want to highlight for you. One is our National School Mental Health Best Practices and Implementation Guidance. This is a set of online modules that many of you who worked with us in the past have gone through and heard us talk about. These modules cover how you create that infrastructure to set up a comprehensive school mental health program. So not any one model, but the structure that supports your programming. How do you create your teams? How do you do a needs assessment? How do you do your screening? How do you select appropriate interventions that are culturally responsive for your community? How to fund and sustain your programming, and then how to measure your impact. These are freely available for your use. There's video guides available to you, but also we provide direct training and technical assistance in how to use it. So this is one resource I would recommend looking into. Those modules are directly aligned to the School Health Assessment and Performance Evaluation System, or the SHAPE system. This is a quality improvement tool that you can access, again, freely available to you online, that allows you to actually walk through each of those domains listed and do an assessment of where your school, your district, your region, or your state would fit within the quality indicators of school mental health programming. So you can use that to help set goals and do some strategic planning. Within the SHAPE system, you have access to resources, free tools, free screeners, free assessments. There is a lot of great information there, including an assessment on trauma responsive care. So another important tool I would tell you to go and take a look at that is freely available to you. Some other things that are helpful resources to know is, one is our Adult Resilience Curriculum for Educators, or our ARC curriculum. So this was created to provide a self-paced guided content for educators on how to promote their resilience, but also organizational well-being within your school or district. This is an example of what's covered within the ARC content. Those modules that you see outlined here in purple are those that we would call the core content that you would complete. Green here are optional content, but this helps walk you through how do you set up your own personal well-being plan to address educator burnout, as well as to help educators, your administrators and leaders provide content and how to do so as an organization. So another free resource that comes with video modules, workbooks, and our training and technical assistance for those interested. Third resource I want to highlight is our Classroom Wise content. This is brand new. It's an online training package focused on mental health literacy for teachers and school staff. This is, again, freely available, self-paced. You can take it online at any point in time. It has, I think, 6 video modules that you can use on your own time to help you learn about how you can implement promote mental health and well-being within your classroom. And lastly, I want to highlight our content on healing school communities in the context of racial violence. We've got a lot of great resources, webinars, and tools here from our learning forum on this content that you can access through our website as mentioned. The last thing I'll highlight here again, if not through our resource, please also check out the National Center for School Mental Health. They have many, many, many tools that we use and borrow all of the time, and they're a fantastic resource for how you can help build and promote your comprehensive programming. So lastly, what I will say is please connect with us. You can join us on our list, on our mailing list. You can join us on social media. You can email us or reach out to us, follow us on our website to see what it is that we're doing related to training, what's being offered, and what we can offer in terms of how to assist you in utilizing it. So you can access our mailing list here. And then I'm seeing some questions. We'll get to those here in just a moment. While we are addressing questions, though, I am going to post for you. We do have our evaluation. So as we're addressing questions, please also take the time to fill this out. The link is in the chat box, the gift or the QR code here. You can access that. So that you can provide me feedback on our content today. And again, like I said, SAMHSA really requires us to gather those so they know that we do the training that we're saying that we're doing. And with that, we can now take some time for questioning. And I'm noticing a comment here. I'm going to go ahead and respond too quick before we just open the floor, because I appreciate your statement here very, very much, April, about feeling frustrated about being offered resources that require you to do more, because teachers are already feeling overwhelmed with their resources, and asking more does not seem helpful or reasonable. And I would absolutely 100% agree with you. And actually we get that feedback quite often. A lot of the effort or the work that we do related to training and technical assistance tends to be with administrative leadership teams in our school districts, in terms of how can you bring this content to your district and implement it within the context of what you do, not adding to it, adding more to the plate. And actually, that's one of the very first things that we do with the leadership is an exercise on what is on the plate and what has to stay there and what is flexible, especially as it comes to the well-being content. But a lot of our technical assistance is around how do we help you to implement it within what you have going, identify what's working, identify what isn't, trim those things so you don't have to just keep adding, but make it more efficient for you so that what you're doing works better for you. Because we recognize exactly that there's so much on your plates already. And how do you do this within the context of the time you have and the resources that you have? And that's part of the technical assistance that we offer. I'm happy to have them reach out, April, or connect with them. So I appreciate that statement. We can open your mics if you'd like to, or you can post questions in the chat here for the few minutes that we have. I'm happy to take questions.
Hey, Brandy, this is Chrissy Mayer. I'm wondering if you'd want to talk maybe a little bit about the mental health learning community that Douglas County Schools participated in. That might be a good just kind of information piece related to kind of the administration piece.
Absolutely. Thank you, Chrissy, for that reminder. So one of the things that we regularly offer are what we'd call learning communities. And what this does, and we pick those based on topical areas that come up through our needs assessments and gathering those from our region in terms of what do folks need to focus on. And so many of these learning communities are with administrative teams within schools or districts, or I think the ones that you guys present or were participated in even had a county team, where we meet with the administrators and a group and a peer group across our 4 states, so we can learn from and with each other on how to implement these practices. And so it really is designed to help provide the guidance on how do administrators take these things and bring them back and implement them within their systems. But they do this within this peer learning network. So they have peer examples they can learn from. They can share successes, learn from what's working, what isn't, share resources, and get guidance and technical assistance along the way. And we offer those, again, periodically throughout each year based on content or feedback that we're getting that people are looking to access. We have one coming up here soon on our Classroom Wise program and how folks can implement that. We currently have one that's ongoing right now that is focused on how to integrate community providers within your school system. So it's really designed for those on the outside of your school systems who are looking to integrate within the school systems on how to do so. One, just how to better understand how schools operate, learning the language, learning the structures, learning the process, how meetings operate, and what role they can play within that so that there's better integration when partnering. So thank you for that reminder, Chrissy. I don't know if you have anything that you'd like to offer for this group. I know you participated in a couple in terms of experience.
Sure, I think they've been super helpful, especially related to kind of learning during a pandemic as well. And one thing that we've done uniquely in Douglas County is getting all 4 school districts on board to participate in those learning communities so that we can have some consistency in the county, which has been helpful. And I want to say that Lawrence Public Schools might be participating in a current one. That's one they decided to do independently. I'm not sure which one it is, but I talked to Jose about it, and he was excited to get some of those resources. So I'm hopeful that there'll be some more kind of local resources coming out, because you're absolutely right. Teachers are stressed to the max. I'm married to one, and I can see it when he comes home some days. So I get it. And so, how do we best support teachers so they can better support students as well? So, Brandy, I really appreciate the information that your center has provided, to our community, and it's been really helpful just from an implementation standpoint. So thank you.
Yeah, thank you for that, Chrissy. I believe, Jose, I think they're in our classroom wise learning community. So they'll be learning that new content. Any other questions? Comments or feedback, I'm open to those also. The link to our website, let me see if I can post that here for you. So the MHTTCnetwork.org/Mid-America. And like I said, you will see there our list of resources, but you're free to peruse all of the other regions as well if there's other resources that you might be interested in. So one of the things that I will make known in terms of our email is we are available for you to reach out if you're interested in some of the things that we talked about today or content in terms of what we deliver. Feel free to reach out, and we can let you know what it is, what learning communities are going on at this time, or what ways we can offer trainings. Much like today was probably what I would consider one of those just universal, who are we and what do we do? But if you're looking for more intensive training on how then do you put it into practice, that's the work that we do as well. And so we're happy to do so. I think with that, I will go ahead and turn it back over to you, Crystal and Deanne.
Thank you. Thank you, Dr. Clarke.
Stop sharing here.
Thank you all for attending today. That was wonderful information. And if you need more information, you can always reach out to Dr. Clarke. I know she sent her PowerPoint, so that will be coming to you. So look for that. Don't forget to set your alarm, because Thursday we'll have another great session for you. Thursday session is You Are a Lifesaver, Suicide Prevention for Educators. So make sure you've got Thursday session on your calendar, and come back and share your lunch and listen on Thursday as well. With that, it is 1 p.m. So we will see you back here on Thursday. Dr. Clarke, thank you. Thank you all for joining us, and we will see you on Thursday.
Thank you.
Crystal.